We'd like to thank our event partner sponsor, Maryland Hospital Association.
Hello, I'm Melanie Griffith, President and CEO of the Maryland Hospital Association, and it's my pleasure to be with you and to join you today virtually. MHA is proud to work on your behalf each day and to partner with the Daily Record on this event to recognize each of you, our healthcare heroes. Your commitment to our patients and communities is truly inspiring. Every day, you and your colleagues demonstrate pride, passion, and readiness to serve. Whether it's the happiest or most challenging moments in people's lives, you're there providing unwavering support. In times of pain, fear, emotional exhaustion, you rise to the occasion. You boot up, suit up, and show up every day. To each of you, the healthcare heroes at all Maryland hospitals, I extend my deepest gratitude. Thank you for your courage, your compassion, and your dedication to excellence. You are an inspiration and truly the backbone of our neighborhoods and communities. My team and I at the Maryland Hospital Association are honored to celebrate and support you daily. Thank you for your incredible service and all that you do to take care of Maryland.
We'd like to thank our leadership sponsor, University of Maryland Medical System.
Across Maryland, we can live confidently because the University of Maryland Medical System connects us to the excellence of academic medicine. From routine checkups to breakthrough procedures, that's a better state of care.
We'd like to thank our social media sponsor, MedStar Health. We'd like to thank our supporting sponsor, Continental Clinical Solutions. We'd like to thank our supporting sponsor, LifeBridge Health. We'd like to thank our supporting sponsor, Shepherd Pratt. The Center for Breast Health at Carroll Hospital is aggressively investing in and rolling out revolutionary new testing and treatment technologies that make cancer treatment more precise and more effective. Led by Medical Director and cancer survivor Dr. Donna Hobart, this world-class diagnostic and treatment technology is especially rare in a small-town setting like Carroll County. These advancements and innovations helped earn the Center for Breast Health national accreditation for breast centers by the American College of Surgeons. The comprehensive diabetes program at Kaiser Permanente of the Mid-Atlantic states offers a team approach to meet the unique needs of its members living with diabetes. Primary care physicians, diabetic educators, pharmacists, nutritionists, and specialists create a tailored program for every patient. A centralized electronic medical record streamlines patient care, and remote monitoring technologies provide insight into patients' sugar levels and foot health. The program has lowered sugar levels and blood pressure for patients and led to substantial cost savings in healthcare expenses and productivity. Comprehensive Stroke Center at MedStar Health Franklin Square earns the highest level of designation from the Joint Commission and the Maryland Institute of EMS Systems. Patients have 24/7 access to board-certified neurologists, neurosurgeons, and neurointerventional radiologists, all trained in the latest stroke treatments. Additionally, MedStar Health operates the region's only 24/7 emergency transport program using state-of-the-art medevac helicopters and ambulances staffed by highly trained emergency response teams. Continental Clinical Solutions is improving health outcomes in the community while advancing diversity and inclusion in clinical research. Continental has transformed clinical trials from simply data collection to a mechanism to deliver much-needed treatment of prevalent diseases to underserved communities. Continental finds undertreated patients who can benefit from continuous interaction with healthcare providers, and then combine regular healthcare visits with trial participation, for which the patient is compensated. The Institute for Advanced Diagnostics and Therapeutics at Sheppard Pratt brings expert clinical care of difficult-to-treat illnesses together with a center of research developing brand new treatment modalities. It conducted the first-ever clinical trial of psilocybin to treat bipolar II depression. Patients of the Institute have access to proven neuromodulation techniques and the most advanced psychopharmacology available. 80% of trial participants meet remission criteria 12 weeks after treatment. Luminous Health unveiled a successful virtual nursing program to improve patient outcomes, reduce hospital readmission, and address workforce burnout. The program utilizes nurses in a remote location who provide patient care using a camera in the room. Luminous has deployed the program throughout 5 units comprising 136 beds. In addition to an enhanced patient experience, the biggest achievement has been that bedside nurses are reporting greater satisfaction with the amount of time they can spend with their patients. Congratulations to all our advancements and innovation in healthcare heroes. The Family Tree leads Maryland in preventing child abuse, connects caring communities, and builds strong families to improve society for generations. The Family Tree promotes a multifaceted range of community outreach activities, including parenting workshops, an anger management program, home visiting programs, support groups, free drop-in childcare, and a phone-based helpline and a web-based chat line. Last year alone, it reached 19,000 people across the state. GKV is a marketing communications agency whose contributions help influence positive healthcare outcomes. The Maryland Department of Health selected GKV to help increase COVID-19 vaccination rates with its GoVax campaign. And the Maryland Managed Care Organization Association relied on GKV to educate Marylanders about how to keep their Medicaid health insurance. Thanks to the GoVax campaign, Maryland's vaccination rate far exceeded the national average, and the Medicaid check-in campaign succeeded in getting 78% of Marylanders to renew. Maryland Apprenticeship Connector brings innovative approaches to solve long-standing workforce development challenges. MAC's North Star is to advance youth apprenticeship programming across all sectors, but especially healthcare. They advanced programming for community health workers, medical assistants, CNAs and GNAs, health data analytics, pharmacy techs, front office and administration roles, among others. Every dollar invested in the program returns an average of $1.47. Chirk House Community Outreach is unique in that it is deeply integrated within the community it serves. Each team member resides in West Baltimore among the very individuals they aim to support on their journey toward recovery. Chirk House collaborates with Catholic Charities for food provisions and Be More Empowered for skills training in an effort to make a more meaningful and lasting impact on the lives of those they serve. Congratulations to all our community outreach organization heroes. Barb Clapp is CEO of Jack and Nancy Dwyer Workforce Development, a successful entrepreneur, national business leader, and committed philanthropist. Barb was instrumental in establishing this first-of-its-kind national nonprofit, empowering and providing jobs to underserved populations while alleviating the healthcare workforce shortage in a brand new way. Under Barb's leadership, DWD saw an impressive 81% retention rate in its CNA and GNA programs, which will serve more than 3,200 people this year. Dr. Derek Dangerfield II is bridging gaps between healthcare professionals and some of the most marginalized citizens using evidence-based practice. An associate professor of public health at George Washington University, he has identified culturally responsible research protocols for engaging urban, racial, and sexual minority men in traditionally marginalized locations like Baltimore City. Derek trains clinicians in culturally appropriate screening protocols for LGBT health, and he has also led several successful research and teaching initiatives for sexual minority health in community-based settings. Maria Fernandez is a community health worker with Baltimore Medical System who leads the Be More for Healthy Babies initiative. She is especially committed to serving pregnant and postpartum Hispanic women, recognizing and addressing the unique cultural, linguistic, and socioeconomic obstacles they may encounter in accessing vital healthcare services. She established and facilitates the Moms Club, an in-person and online group where expectant and new moms can access baby equipment and support in a welcoming environment. Freedom Jones has had a transformative impact on violence mitigation in Baltimore and Central Maryland through the pioneering efforts of the Center for Hope. As Director of Violence Intervention, Freedom oversees all of LifeBridge Health's violence intervention programming. Over the past year, Freedom and her team have supported almost 6,000 clients, conducted about 4,000 counseling sessions, provided 43 trainings to more than 12,000 participants, and mediated more than 900 high-risk conflicts. Dr. Jessica Lee is co-principal investigator of the Maryland Abortion and Reproductive Clinical Health Training Program and the recipient of more than $10 million in state funding to expand abortion training across Maryland. An OBGYN and specialist in complex family planning, Jessica works to provide comprehensive residency training in contraception, pregnancy option counseling, and abortion techniques. As Director of Family Planning, she believes all women deserve access to and support for comprehensive reproductive care. Dr. Natalie Spizin is Medical Director for HIV Community Health Engagement at the University of Maryland, Baltimore. Since joining the faculty in 2022, she has rebuilt and expanded the Jacques Initiative, an HIV education and outreach program. She provides clinical and programmatic guidance to a multidisciplinary team who help people living with HIV overcome barriers to medical care. The Jacques Initiative successfully engages more than 200 community members a year in HIV education and testing, and it supports more than 90 people a year living with HIV. Kelly Truax is Community Outreach Coordinator for GBMC's Sexual Forensic Examination and Domestic Violence Program. Kelly and her team have presented to more than 9,000 members of the community through 102 training and awareness events. Kelly has led the education of more than 3,500 school resource officers, security guards, and school safety personnel on the victimization of youth. This course teaches how to recognize human trafficking, intimate partner violence, child abuse, neglect, sex abuse, and child exploitation. And congratulations to all of our community outreach heroes. Sharon Gladfelter has served a remarkable 60 years at Brook Lane Behavioral Health. She has collaborated with 7 CEOs, 7 CFOs, 5 CNOs, and 6 CMOs to successfully expand services and programs, and she led Brook Lane through its first Joint Commission accreditation. Now the Director of Health Information Management, she began her career as Secretary to the Medical Director. Becoming certified as a Registered Health Information Technician, she was promoted to Clinical Record Director. Her current responsibilities include quality assurance and risk management, as well as corporate compliance and privacy.
I just wanted to originally be a nurse, taking courses through high school. My father decided he couldn't afford to send me through nursing school, so then I went through Maryland Medical Secretarial School. One of my instructors stated there was a job opening at Brook Lane Health Services, which was a medical secretary to the medical director. So I had no knowledge whatsoever of any psychiatric work, what that was involving. Eventually went into becoming head of the medical record department. I think the reason I've stayed in this job for as long as I have is because of the people. The people I work with are really, really good people, and I enjoy my work. My greatest challenge has been keeping up with changes primarily in a record-keeping system. When I came to work at Brook Lane, of course, everything was paper. We went from paper records to half paper, half electronic, and then we went totally to electronic records, and now we're switching to another system. And that's the biggest challenge I've had, is trying to learn another electronic record system. Right now, we're in the second week of a new system, and I'm going bonkers.
A pioneer in sports medicine and orthopedic surgery, Dr. Les Matthews may never have become a surgeon if it weren't for a life-changing orthopedic injury. A legendary goalie at Hopkins and a USA Lacrosse Hall of Famer, he has dedicated his life to helping other athletes. Emeritus Chief of Orthopedic Surgery at MedStar Union Memorial, Les built and shaped MedStar Health's nationally ranked orthopedic program. He created the nation's first hospital-based sports medicine program and spearheaded the creation of the MedStar Orthopedic Institute. He founded the Institute of Gratitude in Healthcare and focuses his energy as the new medical director for development.
Late in my senior year of high school in Baltimore, I had a pretty severe knee injury. It caused me to miss the last part of my senior season, required extensive reconstructive surgery, frankly put my career in somewhat of jeopardy. I was fortunate to have great care both surgically and in the rehabilitation space, and was able to fully recover from that, thankfully, and have a very successful and rewarding collegiate career playing lacrosse at Johns Hopkins. That whole experience was very impactful for me because it showed me the power of the ability to perform surgical treatment on an injured athlete and allow them to recover, and not only recover, but recover and regain a high level of athletic ability following a surgical procedure. I thought that was pretty cool that somebody was able to do that for me, and I thought it would be even more cool if I was able to get to a point where I could do that for others. I think the most significant accomplishment or contribution that I have made was in the development and evolution of the orthopedic surgery department at MedStar Union Memorial Hospital. When I started there in 1981, I was the second orthopedist in the door. We had a residency program that was very much in its infancy, but did not have a robust teaching, research, and clinical environment at that time. I had had the privilege during my training to be at several world-class institutions, and one thing that all of those places had in common was excellence in research, teaching, and clinical medicine. And I knew that that recipe worked, and it was my goal to try to replicate that and develop that at MedStar Union Memorial.
Dedicated to public health and caring for underserved populations, Dr. Ursula McClymont is Chief Medical Officer at Baltimore Medical System, the largest federally qualified health center in Maryland. The first physician to complete a residency in geriatric medicine at Union Memorial, she was a leader in screening older adults for anxiety and depression. She made similar contributions to addressing substance use disorder, making screenings routine, and educating colleagues that addiction is a disease. Most recently, she led a partnership with MedStar Franklin Square to address substance use disorder in pregnant women.
At a very young age, my mother, who had left Jamaica when I was 3 years old, left me with her mother, my grandmother. There were a bunch of books, old books, and one of those books was an anatomy book. I want to be a doctor, so I was going to be a pathologist. The interviewer asked me what I wanted to do. I said, I want to do pathology. And he said, no, I think you would be wasted in a lab. I really think you should take care of people, given your personality. And I'm going to do geriatric medicine. And that's really how I made that decision to be a geriatrician, was because I was going to help people like my grandmother. Our patients have so many issues that they come in, medical, social. I had a patient one day that he was an alcoholic, older guy, and he was in his 60s, not that old. He was an alcoholic, and it was well known. You know, we counsel, we try to get him to use resources, get support, use the medication, etc. And I said, Mr. X, you cannot take your medicine and drink all this alcohol. And he looked at me quite puzzled, really. And he said, oh, I know, Dr. McClymont, I don't take the medicine. I said,
Driven by a desire for equitable, compassionate care for all children, Dr. Aziza Shad is chair of pediatrics at the Herman and Walter Samuelson Children's Hospital at Sinai. An expert in cancer care, she changed the culture of the Children's Hospital, which is now recognized for its welcoming, respectful, and personalized psychosocial care that children and their families receive. She led the introduction of child life, arts therapy, music, and pets therapy, in addition to social work. She also spearheaded programs that include parents and siblings. She is currently working on a school program at Sinai so children with chronic diseases can stay in school and graduate on time.
My advent into pediatric oncology began a long time ago in my own home country, Pakistan. We had so many children that we needed to take care of who required urgent attention for dehydration or infection or malnutrition. that pediatric cancer was not really a priority, and that was unacceptable to me. So I left Pakistan so I could train in pediatric oncology there, and then eventually come back to Pakistan and establish pediatric oncology care there. That desire to make a difference in the lives of children in low and middle income countries never really left me. And that is how I worked in pediatric oncology and at the same time started work in low and middle income countries. So today, I have not only established or helped establish pediatric oncology to some extent in Pakistan, which has now moved way ahead, but in India, in Nepal, in the Middle East, to some extent in Latin America, I've established pediatric oncology care in a country where there was none. Is that enough? No, it's not. So a lot of work still needs to be done. Introducing care, which not only encompasses the child, but the family as well. And that has been my model wherever I have worked, where I feel very strongly that number one, care should never be defined by the place you were born, or by race, or by ethnicity, or by your socioeconomic status. Care should be equal for all. And medical care is not the only care that you provide to a child with cancer, or for that matter, for any life-threatening disease. It should be medical care together with psychosocial care. I think the most important achievement in my life has been to establish that model. The philosophy of care should always be taking care of the whole person.
Over her 40-year nursing career, Carol Ann Sperry has led multiple teams through the challenges of terrorism on American soil, a global pandemic, and everyday life emergencies that affect the community. As Director of Emergency Services and Emergency Management at University of Maryland, Baltimore, Washington Medical Center, she is a trusted leader and a calm, steady support. As she heads into retirement this year, she is proud to leave a legacy of more than 500 nurses that she introduced to and trained for the emergency nursing specialty.
I've had the privilege of working with 500 new grads over my career and forming them into nurses and helping them to grow. And now I have nurses who are colonels in the Air Force and CNOs of hospitals, nurse practitioners, missionaries, all over the world. I actually have one nurse who's a Navy SEAL. It's been my privilege and honor to help people become as passionate and as infected with nursing as I am. The greatest challenge of my career has probably been the pandemic. We were changing gears on an hourly basis and facing a lot of unknowns, and we were learning by the seat of our pants. And as a leader, I had a group of 110 very wide-eyed nurses staring at me in the emergency department and another 100 in the critical care unit looking to me for answers that I didn't have. It forced us to practice in a different way. Families weren't able to be present, so we had to be families for patients. We had to be there during their death and dying and video chatting with family members and trying to hold that whole process together. And to be honest with you, I don't think I've recovered yet. I think I'm still in the process of recovering, as they are.
Congratulations to all our Lifetime Achievement heroes. In the midst of a critical mental health crisis, Shepherd Pratt is revolutionizing mental health care delivery with innovative treatment options at every level of care. Its newly renovated admissions and psychiatric urgent care spaces substantially reduce emergency room stays and served more than 10,000 people last year. It's helping hospitals nationwide through Shepherd Pratt Solutions, its consultation and management division. And Shepherd Pratt is innovating life-saving treatment modalities through cutting-edge research, like its first-of-its-kind clinical trial of psychedelic drugs to help bipolar depression. Co-founder of Africans for Mental Health, Joanne Awor-Apport has made a profound difference in Maryland's healthcare quality. Her leadership and initiatives have been instrumental in breaking the stigma of mental illness in the African diaspora. She's lobbied county and state leaders for equity and parity in mental health resources for the African community. A sought-after speaker on mental health forums and town halls, she has also collaborated with the Governor's Commission on African Affairs to promote mental health education. Dr. Sarah Kutakuri is an addiction medicine physician and researcher who is dedicated to the health of people who use drugs. She created the CalERT Institute for Addiction Medicine at the University of Maryland School of Medicine, which is dedicated to improving the lives of Marylanders living with and affected by addiction. Her goal is to not only help patients individually through clinical care, but to also develop new strategies for treatment through research, train the next generation of mental health professionals, and create systems that strengthen this work. Mary Jane Martz is Clinical Director of Residential Services at Ashley Addiction Treatment. Through her personal experience navigating mental health challenges, she has made an unwavering commitment to destigmatize the conversation around mental illness and substance use disorder. As a leader, she has revitalized Ashley's inpatient program's effectiveness. More patients have access to treatment, fewer people are leaving treatment early, and waiting times have been reduced. As a trained clinical supervisor, MJ is a great mentor to her team, as well as social work students. Daniel Watkins is Senior Director of Behavioral Health Operations and Nursing for Luminous Health. Over his 17 years as a nurse in the mental health field, he has opened 3 new mental health facilities. The projects have allowed him to advocate for the needs of the team, to create a safe environment for patients, and to design a therapeutic setting for healing. He helped the inpatient unit at Luminous achieve full Joint Commission accreditation, and he played a role in enhancing admission processes and recruiting additional support staff. And congratulations to all our mental health heroes. Nicole Noga is Director of Patient Care Services for the Emergency Department at MedStar Health, Franklin Square. She has influenced a significant culture shift from unengaged and low morale to high engagement among all associates. She created a pipeline for hiring new graduate nurses to address the severe shortage. She also expanded the ED's Fast Track concept 3 times to its current 19-bed space, which sees 2,300 patients a month. This has decreased the left without being seen rate, decreases length of stay, and increased patient satisfaction scores. After 40 years at the bedside, Angela Wheeler is known as a nurse's nurse. Team leader in the ICU at Luminous Health Doctors Community Medical Center, Angie is able to nurture a supportive and cohesive team. She is a role model of accountability, encouragement, collaboration, and enthusiasm. She brings fresh ideas and is open to learning new ways to problem solve using lean methodology. She has been instrumental in initiating innovations aimed at enhancing patient outcomes and improving the quality of care. Committed to clinical excellence, Gail Zephyr is Director of Patient Care Services at MedStar Health Franklin Square. A true leader, she is dedicated to ensuring that others uphold the standard of care. Since arriving at MedStar a year ago, she has engaged and re-energized the team, which had struggled to find its identity and purpose after the pandemic. Known to inspire change, Gail's team has twice been honored this year with an unheard-of 10-point improvement in overall score and metrics. Congratulations to all our Nurse of the Year honorees. A cardiology nurse practitioner for 20 years, Catherine Sturiano is a dedicated patient-focused provider who puts a strong emphasis on patient advocacy and education. Known as the Queen of Cardiology by her peers at MedStar Franklin Square, Kate is a clinical expert and a mentor to resident physicians and other APPs. She also serves as the nurse practitioner representative on the hospital's credentialing committee, helping Franklin Square maintain magnet status. Congratulations, Kate, our Nurse Practitioner of the Year. The lead advanced practice provider at MedStar Union Memorial Hospital, Erica Stoner, is a highly respected leader and clinical care provider. A physician assistant for more than 18 years, she has worked on the cardiac unit at Good Samaritan and with the hospitalist team at Union Memorial. A servant leader, she combines a firm, disciplined approach to reasonableness and fairness. She serves as a beacon of inspiration, guiding her colleagues by example and demonstrating a steadfast commitment to excellence in patient care and professional practice. Congratulations, Erica, our Physician Assistant of the Year. A trailblazer and exemplary leader in emergency medicine, Dr. Reginald Brown has transformed the emergency department at Luminous Health Doctors Community Medical Center. To reduce excessive wait time in the ED, he has fostered a culture of collaboration and continuous improvement, leading to a more efficient and effective emergency care system. As the Maryland Advocacy Lead for U.S. Acute Care Solutions and a board member for the Maryland chapter of American College of Emergency Physicians, he has testified before the General Assembly to improve emergency access to care. Dr. Eddie Bullock is Chief of Adult and Family Medicine for Kaiser Permanente, Baltimore, overseeing 64 primary care physicians who care for approximately 147,000 patients. Growing up in a poor rural town in Mississippi, she is passionate about cultivating a diverse physician workforce, eliminating healthcare disparities, and serving the community. One of her many achievements is the Good Health and Great Hair program, a groundbreaking public health effort that offers a comprehensive array of clinical health services, plus career support, fitness instruction, and financial counseling to underserved citizens. Dr. Kritis Dasgupta is Chair of Physical Medicine and Rehabilitation at MedStar Good Samaritan Hospital. A natural leader, he was elected Vice Chief of the Medical Staff, and he serves on the Workplace Violence Committee. Thanks to his leadership, a new comprehensive inpatient rehabilitation unit became a reality, and the amputee program received the Commission on Accreditation of Rehabilitation Facilities designation. In addition to his role at Good Samaritan, he serves as the Associate Medical Director for the MedStar National Rehabilitation Network. A standout physician at Kaiser Permanente Gaithersburg, Largo, and Capitol Hill Medicine Centers, Dr. Luis Ruiz is Chief of Pulmonary and Sleep Medicine for the Mid-Atlantic Permanente Medical Group. He is deeply involved in helping patients quit smoking and ensure strong screening rates of people at risk for lung cancer. To break down barriers to care, Luis has created health education videos in Spanish, and he leads a team of other Spanish-speaking physicians who conduct patient outreach by phone and secure text message. Inspired by a family full of physicians, Dr. Asha Thomas knows the importance of great mentors, and she is most proud of her leadership of the residency program at Sinai over the past 15 years. Vice Chief of the Department of Medicine and Chief of the Division of Endocrinology, she has made a huge difference in the lives of patients with diabetes and their access to life-saving medication. Named one of Baltimore's top docs for the past 10 years, Asha says it is LifeBridge's commitment to communities and the diversity of staff and patient population which has kept her in Baltimore. A leader in cardiac care, Dr. John Wong is director of the Cardiac Catheterization Lab for MedStar Union Memorial and Franklin Square Hospitals. He pioneered the radial access approach to cardiac catheterization, which is now the gold standard. Since this is an outpatient procedure, he championed a hotel-like recovery lounge where patients can be monitored comfortably before they return home. His passion for delivering high-quality clinical outcomes, along with evaluating and implementing new techniques and technologies, is the driving force behind the work his team does every day. To show her appreciation for the great healthcare she has received, Margaret Mutzuk has become a dedicated volunteer at Luminous Health Doctors Community Medical Center. A college student with a chronic physical disability, Margaret shares her youthful energy and a compassionate demeanor, since she knows what it's like to be the person in the hospital bed. Since January 2023, she has volunteered more than 687 hours, mostly working 3 12-hour shifts a week during her breaks from college. A member of the service fraternity Alpha Phi Omega, she gets her friends involved in donating supplies for patients, and she has even recruited more volunteers. Congratulations, Margaret, our Volunteer of the Year hero. Congratulations to all our healthcare heroes.